So we're here to talk about posture of the month for the month of May, which is Dolphin. And Dolphin is a really interesting posture in terms of where does it fall on the spectrum. Dolphin looks a lot like down dog, and sometimes it's actually used as a down dog substitute, particularly for people who are dealing with wrist issues. But it's also a forearm stand and a forearm balance, and it's used as a preparatory posture for getting up into forearm stand. And so Dolphin is kind of like, it's in an interesting half world of postures. It's a little of this and it's a little of that. And one of the things that I love about Dolphin is actually the thing that everyone hates about Dolphin, which is that it's so hard. It looks really easy. It looks like it's no big deal. But Dolphin is one of those postures that is so challenging that it actually has the gift of dismantling your ego while you're in it. And so it's self-limiting. And there are so few postures that do that for you, especially the ones that are really difficult. A lot of difficult postures, challenging postures, they kind of fire you up. They're like, ooh, I'm going to do that. And Dolphin says, nope, you'll do exactly as much of this as you are capable of doing. And so that self-limitingness of Dolphin and that fact that it can be used both as a resting posture or a way of making down dog easier, but also it is how you get into forearm stand. It kind of exists in this nice little sort of mid-range of postures that I kind of am crazy about. We don't do Dolphin on a daily basis in our regular classes. We do Dolphin plank in our regular classes. So Dolphin plank is when you're in plank pose and you've got your elbows stacked up underneath your shoulders. It looks like it would be easier than a regular plank. It's not. It shifts the weight out of your wrists, but it puts more into your core, and it really puts you into a position of having to establish and engage through your core. And so in our posture of the month, this month, we're going to be showing you how to get from plank to Dolphin. And Carmen and Emily are going to give some really beautiful demonstrations on how to do that. And then Emily is actually going to give a demonstration on how to go from Dolphin into forearm stand. And before we show you that video, I want to be really clear that we do not encourage anybody to go into forearm stand. It is a very difficult posture. It requires a lot of strengthening for the wrists, for the hands, for the shoulders, not to mention the tremendous amount of work to do in the core. So as effortless as she makes it look in the video, know that that's from years of experience. And we recommend just spend your time in Dolphin. Don't even worry about getting your feet up off the floor. If you go back to the crow video, where we talked about crow as the posture of the month, the priority is not to get your feet up off the floor. So the priority for forearm stand is not to get your feet up off the floor. Keep your feet on the floor, work on your Dolphin, work on shifting through your body weight. Find how to lift from your core, how to get forward into your shoulders, how to get high in your hips. It could take you 3, 6, 10, 12 months of Dolphin practice to get one leg up off the floor, to start to move into forearm stand. So be patient with yourself. Really spend time working on Dolphin. And if you're not ready to work into Dolphin, lifting the hips up, you want to stay in Dolphin plank, stay there. This is a posture that has so many levels and so many stages. You can really spend time working on and mastering any of the stages. No rush, no priority to move on beyond it. Spend your time where you are and enjoy getting to know your Dolphin. So we start off in plank. Hands are right underneath the shoulders. Make sure that your palms are underneath the shoulders. The shoulders are ever so slightly pitched forward so that you're not hanging back in your feet and you're not hanging back in your wrists and shoulders. Strong belly, strong hips, strong legs, strong core. Plank is tremendous core work, even if it doesn't necessarily feel like it in the beginning. To go from plank into Dolphin plank, the elbows bend and you place the point of the elbow right where the wrist was on the hand. And then again, check in, make sure that the weight in the shoulders is ever so slightly forward, not leaning forward, but just keeping the weight of the shoulders away from falling behind the elbows. Legs are strong and belly is strong and hips are strong and spine is long and the breath is easy, and Dolphin plank is deceptively simple. It looks like it would be easier than a straight arm plank, but it's not. To go from Dolphin plank into Dolphin, the hips go up to the ceiling. Pull the belly in nice and tight and step the toes up towards the elbows, bringing the toes as close to the elbows as possible without letting the shoulders shift their position. Shoulders stay right where they are, stacked over the elbows. Eyes gaze is forward towards the fingertips, and the hips stay nice and high. Pull the belly in and get as high up on the toes as possible, and breathe in and out through the nose. And it's difficult to get the hips right over the shoulders. She's working her way there. Most people will keep their hips in the spine in a position more like down dog, more of a triangular posture. And breathe. Good. From here, step back into dolphin plank. Take a breath. Good. And then knees down, hips down, belly down, and rest. Dolphin plank from plank. Bring your elbows down to the floor. Line up your elbows right underneath your shoulders and find a nice straight, strong line, strong hips, strong legs. From dolphin plank, moving to dolphin, hips to the ceiling, tailbone up, chest lifted. Notice the shoulders do not go past the elbows. The elbows stay right underneath the shoulders, and breathe. It's okay if the heels don't come to the floor. She's got a lot of range of motion that allows her to bring her feet pretty far forward. This is dolphin. Dolphin is half forearm stand. So now to lift up into forearm stand, lifting up through the legs, finding and catching the balance, and breathe. Strong pelvic floor, strong core, strong hips, easy breath, feet floating off the wall.